It is my honor to introduce our next speaker. QSource has partnered several years, and I have sang their praises throughout the state on the hard work that they do. So at this time, I will turn it over to Kathy Martin, Director of Operations, Healthy Communities of Clinton County.
Thank you, Kathy. I'll work on sharing my screen here. All right, I'm assuming that someone will let me know if you can't see that screen.
So Kathy, we do see your screen, but you need to hover up at the top on display settings.
All right. All right, and what am I looking for, Allie?
Display settings right there. Click that.
Yep. And
then swap. You got it.
Ha, how about that?
Perfect.
All right, thank you. So again, my name is Kathy Martin. I'm the Director of Operations here at Healthy Communities of Clinton County. We are in Frankfort, Indiana. And today we're just going to present a little bit on what we do, how we can help others in the rural communities, how we can help duplicate this, what it would mean for you all, and kind of helping ease the burden when it comes to rural communities. So Healthy Communities started in 2006. That's when our first coalition meeting was held. And the whole purpose was to help ease the burden on the rural healthcare systems. And this was through partnerships and grant funding, helping bridge those gaps in our community. And we were working to avoid the duplications of services, reduce barriers. We received our first grant from IDOH in 2008. That was a tobacco prevention and cessation grant. And through that, we just did small projects to start with. We were helping people quit smoking, especially our pregnant population, our rural population. We were helping our schools go smoke-free campuses. The Frankfort Hospital actually did a smoke-free campus because of that grant all the way back in 2009. And so now we average around 40 people monthly at our coalition meetings. We always meet the second Thursday of every month. We provide lunch. We're not above a bribe. We will bribe people however it takes to come in. But then at those meetings, we just share updates of what grant funding we have, what we're doing out in the community, but then also all the other organizations that are present. We have over 170 people on our email list. So organizations can let us know that, hey, this event is coming up, or hey, our hospital is doing a diabetes prevention program. Can you get this out to the coalition? And so those go out as needed. We've worked with QSource in a lot of different ways to help our community and make those partnerships between hospitals, between medical, and between other organizations here in our community. So some of our programs now that we have our prenatal program. So we provide free pregnancy tests, free prenatal vitamins and folic acid. And then we also have prenatal classes for our new mamas, whether they're new or this is their second or multiple kids, they can come in and receive that care. We know that when it comes to our healthcare system, sometimes there's not as much time needed to answer all those questions. And this is to help bridge that gap. So they are receiving classes on breastfeeding. They're receiving classes on child safety. Do you have a safe sleep set up for your baby? Do you need a bed rail for your toddler? Do you have baby gates? What about those safety things in those first few weeks of care and months of care for that newborn? We're also helping when it comes to diapers and wipes. Is that something that is a gap for individuals? And so we have different grants, but then also volunteers and other organizations that are helping with that. Our substance use disorder prevention programming, some of those are in the schools. Think of like the DARE program, things like that are in the schools. We currently have SUD prevention programs at our kindergarten levels, 5th grade, and then also at the high school levels. So those are all going on. We reach over 700 youth each year at our different schools. We have 4 county schools here in Clinton County, and we're in all of those with different programming with that. Most recently, we've started our peer recovery coaches and recovery services. You'll hear a little bit more about this later, but we kind of went outside of prevention for a minute and went into recovery because that was a gap in our community. It was something that was needed. And so how could we help? And so we started with 1 peer recovery coach. We now have 8 on staff as of today. Part of those are part-time and some are full-time. So helping our recovery community, and you'll see a slide about more of that here in a little bit. We have systems of care. Those systems of care navigators are individuals who are doing wraparound care. Think about whole person care. We can't help someone with SUD if part of their trigger is not being able to provide food for their family, is their food insecurity. So how can we help? Let's get them resources. Let's get them to food pantries. Let's get them SNAP benefits, whatever that might be in that. We can't help someone with mental health and anxiety if one of their triggers is not knowing where to lay their head at night. So those systems of care navigators are filling in those gaps that don't necessarily fit in one program or another. Sometimes it's referrals to treatment. Sometimes it's helping with job application or fixing their resume, helping with housing and that sort of thing. So all of those things would fit under systems of care. We have community gardens. One is out behind our building here in Frankfort, but then we also have them in our small towns. So not just come and pick a veggie. We have one rule with it. If you pick a veggie, you have to pick a weed. But beyond that, how do you prepare that? What do you do with fresh fruit and vegetables? So we have some cooking classes and we partner with Purdue Extension to help us with that, to teach nutrition and what to do with fresh veggies and helping your family with that. We also have insurance navigation through Covering Kids and Families. So helping individuals with insurance, getting them PE into treatment if they need that, or mental health services. We have youth IOP programming here. We've partnered with Sycamore Springs in Lafayette in order to have kind of a transplant office here to help those kiddos in Clinton County that are needing services, but that transportation is a barrier. And so now we can go and pick them up from their school in the afternoon, bring them to our office for that programming. We do help with transportation. We have Paul Philippi Resource Center here in Frankfort that is our public transport, but there's still gaps. There are still times when people need to leave the county in order to get treatment, or kiddos need picked up at school in order to receive mental health services, things like that. So we actually have a car here at Healthy Communities. It started with our county commissioners allowing us to have a vehicle that they donated since we didn't have birthing hospital here in Frankfort anymore. And so that's expanded. We do help prenatal clients if they need assistance in getting places, but then it's also beyond that. We're a car seat inspection and distribution site. So we work quite a bit with our local hospital here in Frankfort, but also in Lebanon and Lafayette, helping with that, helping fill in gaps, along with the safe sleep. That all falls into our prenatal programs. We have evidence-based programmings in our schools and our community. We do programs such as Too Good for Drugs, Sources of Strength, Lions Quest, Guiding Good Choices, which is one of the parenting programs. And we have worked with our grants and making sure that individuals here at Healthy Communities are train the trainers so we can hold sustainability not only for these programs, but to help others. Most recently, we worked with Carroll County Lifeline to get them trained up so they could provide that programming there in Carroll County to those schools. So we work a lot with that and making sure that we can duplicate this. We don't want it just for Clinton County. We want this, statewide and however we can help. We also have our Youth Rise Leadership Council. That's comprised of 9th through 12th graders here in Clinton County. And it is all about youth-led initiatives. And they get to pick each year what those initiatives will be. And then they are doing those in their schools and in the community and different resources. You'll hear more about that later as well. And then we also have physical activity. We have walking and biking paths that we have done throughout Frankfort and throughout Clinton County, making sure that we hold events for those things and keeping people active when we're able to do that. One way is our Stepping on Stigma campaign. So Stepping on Stigma combines a lot of different activities here in Clinton County. So These are things like learning breakfast. Think about like a lunch and learn, but it's for breakfast and it's all about mental health. And we want to make sure that we can provide professional development or CEUs to individuals that need that. We provide breakfast. It's always free of cost, and it's a different training every other month. We can do this virtually or in person. So those are things that people can be involved in to help with that. We have mental health awareness games. We started this back in 2018. We actually had a local teen who lost his battle with mental illness, and we partnered with that family to create Stepping on Stigma, the 5K that we hold every year. We get over 200 participants each year in that. We're in our 6th year, and it looks like we're going to hit about 300 participants this year. It's coming up on May 13th. And it's just about stigma-free. It's about talking about mental health. And then from the 5K, we moved into our mental health awareness games. We provide shirts for the teams. They can wear those during warm-up or before or after games. And we have now done volleyball, basketball, football, and we are expanding into baseball and softball this spring. So last year alone, we hit over 10,000 individuals. We have a broadcasting company here called ISC Network. They do the broadcasts of the games for us that reaches multiple counties. Our Youth Rise are there with a table. You can see the picture there of the Stepping on Stigma, You Are Not Alone. We get giveaways and goodies, information about programs and about mental health. It's all about that it's okay to not be okay. It's also okay to talk about it and to have this mental health conversation to kind of seize the awkward. You know, we're using all of those campaigns that are out in Indiana and nationwide. We've also brought Send Silence Packing to Clinton County now twice. That's a national display that travels, and it's all about, again, the stigma and the awareness. They display backpacks throughout wherever you might be. So we held it at one of the local parks here in town. We paid for the schools to bus in their students to walk through the display. Each backpack that is displayed has a story of someone who has lost their battle with mental illness, and it's their story written by their family. And we have had local stories donated, so that's always something that's very powerful. It's always something that brings up a lot of conversation. Last summer, we had brought it back for the 2nd time, and we had a student come up to us and share that he did not want to be a backpack. He needed help, and he didn't want to be a backpack. And those are things that are powerful to have those conversations and to do that. We always do presentations at our mental health games, whether it's between innings or whether we do something a little more in depth at halftime and between games, just to have people talk about it. We didn't know how that would start. We didn't know how that would go and how it would be received by the community. But anytime we've done these presentations, you can hear a pin drop in the gym. And if you've ever been to a Friday night basketball game in Indiana, you know how loud it can get. And to just see that reaction in the crowd and the reaction of the students, that's what we are hoping for, to help make that difference. We also do a poster project. We call it Healthy Highs. So talking about mental health and substance use disorder, we are working with our schools to get those students that are involved in extracurriculars. Doesn't necessarily have to be athletics, but we also do FFA and band and choir, our dance team, different things like that, just our student leadership, and to talk about their healthy highs, to talk about mental health statistics, and to see those leaders in their school on a poster talking about, you know, whether it's substances and that they don't use it, or whether it's mental health, that makes an impact for students. Our city had also let us do banners around the square with these students and different things. So that's been really good to have those conversations in our community. We also do our community baby shower each year. This last year, we had over 70 mamas come out to our community baby shower. This is just a fun time for anyone who is pregnant or someone who has had their baby in the last 3 months. They are welcome to come and bring a guest. As you can see in some of the pictures, we have vendors that come out that are spoiling these mamas. They're doing fun little giveaways. They are giving them information. People like WIC and First Steps We have a local pharmacy that comes. We have our Frankfurt library that'll come and be a vendor just to give them information that is educational. But then we're also playing games. We're also giving them cupcakes, and we're having punch and doing different things with them, because a lot of these moms don't even have a shower of their own. And this is a way that they can come and enjoy that, celebrate that pregnancy. And then all of the moms leave with at least one big gift. And when I'm talking big gift, I mean like it's a $200 Amazon gift card. It's a new car seat. It's a pack and play. It's a stroller, different things like that. Some years, depending on donations, they actually leave with two big gifts like that. So that's something that they're always grateful for. And again, it helps bring out the conversations of there's help out there. Ask questions, ask for help, reach out, let us help in this education part. We have talked with our local hospitals, and down at Witham, a lot of our moms actually deliver at Witham just down the road in Lebanon. And we've talked to them, and they have said that the moms that come in are more prepared and better educated than the moms who have not gone to, whether it's just a community baby shower or some of our prenatal classes. And that's our goal. We want them to be ready and prepared and ask the right questions so they can receive the care that they need to. So this is some of our recovery projects. So we expanded into recovery now almost just 2 years ago with our first peer recovery coach. And so now we have 8 on staff. When we went down to Atlanta and went to a conference down there, one thing that we really came back with is that recovery is community. You know, those who are living in recovery, they want to give back. They know that they have burned bridges. They know that this has been a problem for them in the community. And so now how do they give back? How can they help others throughout their recovery journey? And so we have what we call Families Recovering Together nights. That is open for anyone who is in any stage of recovery and their families. What we found at the first few is that they sit down to eat, we feed them dinner, and then we do an activity together. And when we were sitting these families down for dinner, they weren't talking. And it's just because those bridges hadn't been built yet. They didn't know how to have a conversation with their family. So giving them some prompts at the table, helping them with that, and then being able to do a family activity together. We've done a pasta and painting night. So we did pasta bar, and then they went and painted a canvas together as a family. Beyond that, they get to leave with that activity to go home with them so they can replicate it again at home. So they all left with a painting kit they could do together as a family. We've had family game night where they rotate in game stations every 10 minutes. And then later as a family, they get to vote which game was their favorite, and they go home with that game. Being able to see these families start to rebuild those connections has been huge. There's no way to put into words to see those connections being built. It's just a fun time to get together. We did an Easter one back in April. So all the kids got to do an Easter egg hunt. They colored eggs together as a family. Yours truly had to be the Easter bunny. So those are just fun nights for our staff, but also for those individuals in the community. And this recovery community is huge and essential for our community. They are volunteering their time at the food trucks. They're volunteering their time to help us in community gardens. They're always asking, are there volunteer opportunities we can do? How can we help? Are there things that we can move for you? Are there things we can paint? It's astronomical, all that they are giving back. We did a Recovery Out Loud event last year. That was our first one. We're really excited to continue that again this September. And so each individual who was living in recovery had a purple shirt on. You can actually see that in the picture in the bottom left. Anyone who was just there as a community member to help support, they were actually in a blue shirt. And it was huge just to see that support together with everything. We help support Brianna's Hope, which is a support group here in town. That started, our first one had 17 individuals. It's been going about 18 months now. And it was 3 weeks ago, there were over 80 that came. And Brianna's Hope is not just for those living in recovery. It's for anyone who might be in addiction currently trying to get to their recovery, but also community members. So friends and family can come. And the best part of Brianna's Hope is when you walk in, you don't know who might be living in recovery, who might be struggling right now, or who's just there to help support others. So that's really great. In the upper right-hand corner, you can see a picture of Trinity Hope Center. So just at the 1st of April, we have opened our first recovery center that is open to the community here in town. So we do have a men's recovery home and a women's recovery home, which are doing fantastic. We partner with them quite a bit. And so Trinity Hope Center is open for programming, whether it's our families recovering together nights. We also have women's cafes through Be Strong Families and couples cafes, a prenatal cafe. We're doing all of those. We have video game nights that are open. And then every evening there's a program at Trinity Hope Center. And it's also open if they just need a place to go. If there is a family that just needs a safe place to go play games together. If you're struggling and you just need somebody to talk to, there's a coffee place that you can just go in the basement and have time with others. So this is huge. We never imagined 2 years ago that we would expand this quickly and that we would actually have to have a second Healthy Communities building, one just for our recovery community. So we're partnering with one of the local churches to have this open, to be able to rent this building and be able to continue to expand. I would like to point out the bottom right picture. This is our peer recovery coach, Chris. He's the one in the Hope shirt. Then that is Chief Shoemaker, our chief of police here in Frankfort, and then Mayor Sheets, our mayor of Frankfort. Why this picture is so important is because 8 years ago, Chris was here in Frankfort. He was living in addiction. He went into a CVS and robbed CVS at gunpoint. And yet 8 years later, he's now taking a selfie with our chief of police and our mayor, who are two of his biggest fans. He works at Healthy Communities full time. He donates his time and his energy to the recovery community, and to see his growth from 8 years ago to where he is now, the director of our recovery services here at Healthy Communities. That's what recovery is all about. And these are things that can happen. This isn't just here. These are things that can happen in any community with the footwork and the effort. This is our Youth Rise. So this is the Youth Rise Youth Leadership Council for this year. These kids are comprised of all 4 county schools, including an individual who's also homeschooled. So these are kids that are freshmen through senior. They are doing those youth-led initiatives in our community. So all of the things that I've talked about so far, they are involved in multiple ways. They're involved in our substance use prevention program and mental health. They're doing our Sources of Strength program at their high schools. They've started what's called stall talks. And so all of the bathrooms at our community schools have a cover on the inside door of a stall. So if you go to the bathroom, you close the stall door, there is a Youth Rise newsletter that they update each month based on what their initiative is, based on some of the upcoming events or things that they're doing. They're doing things like drug take-back days. They're partnering with our police for that. They're doing the Stepping on Stigma 5K. They're volunteering at our Families Recovering Together night. They're leading mental health in their schools. They're talking about teen dating violence and relationships and how to have a healthy relationship. They're doing teen cafes, just talking about things that are hard to talk about, having those hard conversations and those hard questions. This is a wonderful program. We love working with the kids through this, learning from them, and then also helping them to do this. This is something that they get paid for, so they're getting volunteer hours, and they're also getting paid each time they come to a meeting. So not only do they have to fill out an application to apply for Youth Rise, they also then do an interview with us, and then they get accepted or not. It's just like a job. And then when they come to their meetings, they get paid in gift cards, $10 for every hour, whether that's meetings or their volunteers or their events. They get paid to come just like you would for a job. So we're trying to teach them that responsibility beyond all the things that they're doing for their community. We get a lot of positive feedback from our schools. They do a patch program on healthcare. They're talking about teen pregnancy prevention. That's how this all started, through a teen pregnancy prevention grant, and it's grown now into this. We're entering now into our 9th year of Youth Rise. So then we're involved in our schools and our community. You already heard a little bit about our community gardens. We're also involved with Red Ribbon Week at the schools. We're helping provide those prizes. Our Youth Rise kids are going down, talking to them about vaping and fogging, talking to them about substances and how you can make better choices. You can make these decisions, and being involved for that. We're helping provide professional development for teachers, CEUs for others in the community that might need that. And we could do that through our Sources of Strength program, helping bring in speakers or others who might provide the training that they need. We've provided LAMP training for our SPED teachers, just different items that those are in need. This is a gap that the community needs. So how can we help fill that? How can we help others? Providing the Walk to School Day. So we're helping coordinate with the schools with Walk to School Day. You can see the walking school bus there. We're doing walking and biking paths. We're getting people out in the community and active. One thing that we heard a lot was that, well, we're in a rural community. You can just ride your bike down the country road, or, you know, if you're in town, you can walk to school, but then what? What else do we do? And so relying on others to help us with those paths, those biking routes, those walking paths, and then showing others in those events that, hey, this is where the path is, and look what you can do and learn along the path while staying active, not just for you, but then also for your family. One big thing that's come up for us recently is our Opioid Settlement Fund Task Force. So when the opioid settlement funds came down from the state, we were asked by our city and council to head up a task force to determine what to do with these funds. As I'm sure most of you know, there were unrestricted and restricted funds. So this task force met multiple times. Our executive director, Laura, headed up that task force as asked by our city and county. That was a huge thing to be able to do that for the community. We brought in multiple other organizations to the table. We had our sheriff and our police, we had our recovery homes, we had other youth serving organizations, we had our schools, we had our city and county government. We had multiple of us sitting at the table to figure out what we could do with this to continue to help our community. I'm happy to report that for both our city and our county, not only did they take the recommendations that the task force provided, but they took all of the restricted and unrestricted funds and put back into prevention and recovery. They were able to do that with different fundings of programs in our recovery homes and organizations, but all of those funds that came into Frankfort and to Clinton County went back to help others with that. Then what came from that is that we actually got to present to the Commission to Combat Substance Use Disorder with our next level recovery. So Doug Singer contacted us and asked if we would present what we did in Clinton County. And so you can see on the picture on the right, we have the president of our city council and the president of our county commissioners there with our executive director presenting what we did with the settlement funds, how we continue to help others, why it might have been different than other communities, that we had already established a lot of footwork. We'd already built the bottom of the pyramid. So then having these conversations with others, everyone was on board to continue to help with that, that we have been able to continue to expand and show others in the state how we can build, how recovery is community, how you can have prevention programs that continue to work and that are sustainable, how this can continue to ease the burden on healthcare just by doing a few things here or there. So that was a really big thing for us here in Clinton County. So then overall, what does this mean for you? We have health checks that help reduce chronic illnesses. So we call this program the 46041. It's free healthcare checks that we do in our factories. We do them at our local YMCA. We do them at our Paul Philippi Transportation Resource Center. We're doing these at nursing homes. We're just doing this what we would call a simple health check. It is blood pressure, it is your BMI, your height, weight. We're doing a finger prick to check your sugar. For most people, this is no big deal, but we have found a lot that have been either pre-diabetic and had no idea, high blood pressure, and we were able to send them in to their doctor. We're not there to say what might be the problem or not, but we're here to help give you the information and encourage you to also then go to your doctor if there might be a problem. We're also helping with education with our prenatal classes, with our Youth Rise kids. When we're there with our peer recovery coach and presenting on SUD and mental health, we're helping reduce time needed at doctor visits, hopefully easing that burden there on healthcare. We have 3 nurses that are here on staff. We also have a certified nurse midwife that is here on staff. That's by no accident. We have 2 that used to be teachers. We have our 8 peer recovery coaches. So those who are now living in recovery, they've lived through that addiction. We have always said that it doesn't matter what background you came from, but what can we teach you to help our community? What is your background bringing to help others? And so that education piece is huge. Then we have our substance use disorder and addiction training. This is naloxone. We have naloxone boxes throughout our community. Those are open 24/7. We're also doing community trainings for anyone who might need those in the home. If they're living with someone who might be in active addiction, or maybe it's just an elderly parent or someone who needs those medications for a proper use, but just in case, we need to make sure that we have that on hand. But also teaching medicine lock boxes and safety when it comes to medicine, not just your prescription medicine, but also your Tylenol. You have your community health needs assessment. We've worked with North Central Health and IU Health doing those community health needs assessments. Not only does that help us and help bridging the gaps and finding out what we could help with or writing grants for to continue to help our community, but also helps us as we're presenting out to the community, getting that education out there to the individuals in the community. And then we have evidence-based programming and evidence-based practices in schools and the community. We're just helping increase that knowledge and reduce the initiation of substance use. And we know that those data points are always delayed by a couple years, but we also know that while we're doing this and helping in prevention, that those things don't go unnoticed, that we may never see what we did change down the stream, but we know that it's making a difference with our youth. Insurance navigation, hopefully it's one less step for the healthcare system, that if we're able to answer just a simple insurance question, that can take more time to help others in the healthcare system. If it's a question about changing insurance or there's a new medication, what does insurance cover or not cover, being able to help answer just those questions. And then grant writing, more available funding for prevention and recovery programs. Our budget that we normally bring in is around $1 million. So this last year, it's going to be about $950,000 that came into the community for prevention and recovery services. And that's huge, being able to do those programs and to provide those things for the community. And then replication for other communities. This isn't something that we're just keeping to ourselves. We want others to be able to do these same things. How can we help? Can we provide training for other communities, whether it's here's how we got started with our coalition, or whether it's something of providing a training for Too Good for Drugs or Sources of Strength, being able to have that with other communities that might use those to be able to start in their schools and their communities, being able to provide, we have a trailer called Not in My Room, and it's an educational display. It's interactive, it travels. And teachers and parents, caregivers can go through that to see how youth might be hiding substances, whether that's alcohol, whether that's marijuana, whether that's other substances, including vaping in that as well. And so how can we help? How can we show that that trailer is free to travel and free to all of you? And we've had other communities now have their own trailer to be able to do those things. So that's really what we're here for, to help ease that burden, to help continue to provide trainings and more information to other communities that hopefully are bridging the gaps that can ease the healthcare system. So I'm not sure if any questions came in. I'm happy to do that. I'll stop sharing my screen here.
Hi, Kathy. Thank you so much for doing that. We did have a question come in about from Amy. Can you provide a list of vendors that were at your community baby shower?
Yes, I am happy to do that. And I can send that out if you want to send it out later too. But I know off the top of my head, we had WIC, we had First Steps, we had our library, we had a local pharmacy that was present. Purdue Extension was present. We had a Healthy Communities table that provided car seat and safe sleep. We had our local hospital, and one of our nurse practitioners was present to help get people ready and set up for that. There were 12 total, so I think I hit about half right there, but I can send that list.
All right, great, thank you. And then Phil had, he said, very impressive program, Kathy. And how do you get the message out to your community about the wide array of services you guys have?
Yeah, so social media is huge for us. We are out on Twitter and Instagram and Facebook pretty regularly, but beyond that, it's been boots on the ground for us. So going to our community events, having tables and doing those things, just making sure that people know that we're available. We still get people every day that say, we had no idea that you did X, Y, or Z. That's normal for us. We're used to that. So just continuing to share and continuing to make sure that we share with those that can share with others, you know, our healthcare systems, our other youth serving organizations, you know, those connections are huge to be able to not only help one another, but also get those messages out to others that we're available to help. Our big thing is that we're not going to pass the buck. We want to make sure that if someone is calling us or asking for help, then we are getting that warm handoff or helping them right in there. Yes, and Kathy, I saw your question come in. Yeah, we ask our vendors as well, those who are doing vendor tables at our events, whether it's community baby shower or our 5K and Stepping on Stigma, to continue to pass that information along. Our coalition email list is huge for us too.
I'll turn it back over to you. Do you have other questions?
I had no questions come in. I'm just sitting here almost feeling exhausted though by all the activities you have going on. So just wonderful what you're doing in the rural community in your area. So any other questions? And just as a reminder, you can either put those in the Q&A portion of Zoom or you can enter them into chat.
Yeah, and thank you for having us. If anything comes up, please let us know. We're happy to help. This isn't some secret that we can't share. Any way we can help others, just let us know.
Okay. Well, thank you so much, Kathy. We just really appreciate it, and a lot to take in. So if you can share that list of vendors with us, why we will get it out to everyone when we send the recording link out later today. And